Hello, Professor Dr. Salma Siddiqui. Thank you for joining me for my YouTube channel. And Professor Dr. Salma Siddiqui is Dean, School of Social Sciences, National University of Science and Technology, Islamabad, Pakistan. And we will start with a brief introduction. So would you please like to introduce yourself to my viewers?
That's the hardest part, to talk about yourself, introduce yourself. But I think you already talked about my position, which is a dean. But before that, when I came to NUST, I think my introduction became that program that I started here, because we started the Department of Behavioral Sciences, and the purpose was to introduce in the field of psychology a program which is based on competency, which I found and thought that is deficient, and especially in our country. So it's starting a debate, and then struggling to establish a program which very specifically focuses on competency. So because I'm by training a clinical psychologist, so the first program we started was MS in clinical psychology. So it's the 10th year of our department. A lot of, I think it's an important time for reflection and to see how we have done, and we are engaged in that process. So that we can correct certain things that need improvement, and also look at the future, that what other programs need these kinds of perspective. Because I think psychology is not an easy field. It requires a lot of competency to be really effective in understanding the subject matter. So I'm just a learner who's engaged in learning each day, and I learn from my students, my colleagues, every day I find that there's so much for me to learn. So I would define myself a perpetual learner, and that is the most happy place to be.
Yes, thank you very much. Yes, because I have been working with you for the last few years, and I know that you have been a soul and life to Department of Behavioral Sciences at School of Social Sciences. And today I have some specific questions, because I have also observed while working with you that students who are doing master's or PhD in clinical psychology, sometimes I found them struggling with the qualitative research method. So today I am focused on some questions, and I will ask a few questions from you. They are very specific. So my first question is that what is the role of qualitative research skills for the researchers or students doing clinical psychology?
That's a huge question, very big question, because you are bringing in your question not only the field of clinical psychology, but how we approach this field through different methods, and qualitative research method is just one way of approaching that, and a very important way. So because I have interest in literature as well, so I'm reminded of a couplet of Ghalib when I was like thinking about this, and it just came to me, this couplet from Ghalib. I'll recite that couplet, and also then for your viewer understanding, those who are not well versed in the language, I would try to translate it. And I also have a parallel in English literature, so I think I would do some justice with the other authors and poets too. So Ghalib is profound impact on our literature and on our lives as a poet and as a writer. So Ghalib says, "Katre mein dajla dikhai na de, aur juzv mein kul, khel ladkon ka hua, deedae bina na hua." So we can translate somewhat. And if the river is not visible in the drop or hole in the pot, then it's not a seeing eye, merely a child's play. But Blake has said something similar, and how he says, "To see a world in a grain of sand and a heaven in a wild flower, hold infinity in the palm of your hand and eternity in an hour." I think this is what the essence of qualitative psychology is. So, before we started studying psychology as a discipline, as a science, There are poets and writers who have already tried to understand the human mind and human spirit and human experiences, and how they admit their own limitations is something one must always keep in mind. So if the river is not visible in the drop or hole in the pot, that is the question. Do we see that? Is it important for the field of clinical psychology to see the whole in part? Can we see the whole in part through qualitative research? That is the question. Is it relevant to the field of clinical psychology? And I'm thinking how it is not. What is the counter argument? Because as a clinical psychologist, all that we are interested in is in human experience, is in the experience of the person who is sitting right in front of us. And it is the meaning that this person gives to his or her own experiences. Because no matter which clinical perspective theory I am coming from, and until and unless I have an understanding, an empathic understanding of the mind of the person or the reality of the person, that the person is trying to define himself, herself, or the experiences that the person has gone through, I would not have empathy. So we use different words, empathy, alliance, rapport, but all means that it's a capacity to see the inner world, the subjective experiences, and they have worth. They're worthy to be seen in the light of the experiences of the person that the person is you are talking to. So this is the position that we take. If that is the position we take as a clinical psychologist, and we are not coming from a very structured and sometimes we do that too, unfortunately, that we try to impose our perspective, our view of the world to the client's view of the world, and say that you are having this problem or suffering because you have this point of view or perspective. So you clear your lens and see it like this, the way I am trying to tell you, and then all your problems would go away. Unfortunately, this is not therapy. In Pakistan, most of us take therapy like this, that I'm the expert, I'm telling you how it will work. It is not paracetamol, that the chemical agent is going to like treat your headache and remove the pain. Until and unless I enter into the world of the client, I would not have an understanding, and with that ignorance, no amount of expertise can be helpful for the client. So I establish my understanding of the clinical psychology, of the field of clinical psychology that a psychologist engaged with is like this. So if I'm saying that, if that is how I define the field, then the process of discovering the meaning that the client attaches to the experiences, or the distress that it is emerges from, the discovery process is something that is akin to the qualitative research method, qualitative field of qualitative research method. Because here also you are employing your capacity to listen, enter into the world of the client. So listening and what are their stories, how they process their stories, and what kind of meaning they're making out of those life's experiences. This is what we are doing as a clinical psychologist. And this is exactly what a qualitative researcher has to do. Your own lens, you may have a many lens, but if your capacity to really, in qualitative research, we call it bracketing, but if you cannot like identify your own lens and then listen to the client's stories, you would have a bias. So this bias is the same in both fields, I think, to my understanding. And that's why in qualitative research, we talk about reflexivity, that this is something that is very important, personal reflexivity and epistemological reflexivity, both are important. But I think that for me, I can't say that I am a qualitative researcher. I am interested in that. I am still learning, but I think that this is something that is common between the two fields, and that's how qualitative research is so suited to the field of clinical psychology, because here again we're trying to discover the inner world of the person that we are interested in. And in qualitative research as well, we are trying not to be limited by own lens to see the world that the person is trying to um, communicate and share with us. So I hope I'm answering your question. If I'm
Yeah.
not, if I'm digressing, please let me know.
Yeah, exactly. Actually, it is wonderful to hear that. Well, you start with Blake and Ghalib, and I do have interest in poetry and literature, and I can understand the depth of those verses. But it is interesting to see that how the clinical psychologist dealing with the clients and how the qualitative researchers doing in-depth interviews, they have a very close connection in terms of interaction with the participant or client. That is interesting. So it means that the students of qualitative research in clinical psychology, or the students who are doing their thesis in qualitative research in clinical psychology, they must have uh, some skills with them that may help them both in doing interviews, and in future this might be a kind of asset for them to conduct an inquiry with the clients. Do you think so?
I wish so. I wish, because just before your session, I was talking to a student, and I think she has been taught how to ask question, how to probe, how to enter the world of the client. But when she uses the same skill doing qualitative research, and I asked them that you are saying that this is the code, can you give me example of that code so that I understand that the code you have applied rightly reflects the content that you are citing? So I don't see that connection. And then again, when they try to synthesize and codes into categories and the themes, so I don't see that very smoothly done. So I don't, it should facilitate, it should be easier for them, because this is what is inherently required as a clinician to work with the skill set. So when you're doing a qualitative inquiry, you should be much more assisted by those. But unfortunately, that is not my observation or experience. Though I had a couple of students in the past who worked on something very difficult, an area that I thought that this is very difficult. And because developmentally, they are not that mature. The students, when they undertake research, they are developmentally not mature. They may have this knowledge about the constructs and concepts, but to apply them in a real setting, it requires developmental maturity. So it is this gap that leads to problems. So one of my students who was studying a very difficult area of self-harm, and she had what I just mentioned as a skill set. She had some of it. Even then, the difficulty that she was going through, and I was holding using my clinical supervision and research supervision, both the kind of skills that you require to hold the student there, so that the person doesn't feel distressed herself. And the process is you can say the process is as transparent as one requires for qualitative research. So she was able to do it, but it was so much very demanding for her. So therefore, I learned a lesson that even when the person is ready, developmentally, it is too difficult, or I think it's not wise to ask your student to engage in qualitative research in difficult areas, in sensitive areas. So we have to create a boundary. You can do research in this, which are a phenomenon which is like a normal everyday experiences. But if it is like a clinical from a phenomenon which is like more clinical nature, then I think as a supervisor, I would ask not to delve into that part.
You're right. So you think that the sensitive issues, like, for example, I have seen some students who were working on child sexual abuse, and they claim that they have interviewed such persons who have been gone through this painful experience. So you think that these kind of sensitive issues, students should not probe these issues in their research?
No, I think it's the ethical responsibility of the supervisor to assess the readiness of the student, and it should be a no-go area. Why? Because, you know, as a clinician, the safety of the respondent, whoever volunteers to be part of your research, is very important. If I can foresee that the client, if a respondent would like really recall some of the disturbing events in his or her life, because the way you asked, because I am aware of some of the incidents when they asked about questions about trauma, and when the information came to the interviewer, the more than the interviewee, the interviewer was really distressed, and the interviewee had to like console the interviewer because they were developmentally not mature. So I think it should be a no-go area. Sexual abuse, self-harm, suicide, this is not the area for novice researcher. This is
Right.
not the area.
Yes, I understand that. And yes, the more sensitive area you are looking into, the more ethical issues will come up. So that makes sense, that why young students or novice qualitative researchers should not go into the sensitive issues. Now, what do you think that the meaning making process between the researcher and as an interviewer, and the interview in qualitative research, and a clinical psychologist and his client or her client, what do you think, what is the difference of meaning making process between these two different areas?
As a clinician, we are looking at the, like, for instance, if we are trying to assess the distress, so we are interested in looking at the way the meaning making is taking place. Is there something in the meaning making process that is leading to the distress? And likewise, when you are interested in the treatment or intervention, you're looking at the how is this treatment helping the person, how is he receiving it, what meaning is he attaching with this treatment modality that is contributing to the improvement. So both are important, because one is assessing the distress at an individual level, and the other is looking at the efficacy of the treatment or the intervention. So these both questions are important to inform the clinician, to understand the process, that this is going to stay with the client, and is going to stay helpful with the client. Likewise, when you are informing to the researchers or your colleagues who are user of those research, this becomes very important, that what you indicate as a change, and what you indicate as this is how it is helpful, so you understand and connect the outcome or the effect through this meaning making process. Because we are not only interested in the some change indicators, but also the process through which this change is reflected. Because sometimes the change is transitory, sometimes the change or improvement is an artifact of something else. So unless and until you understand the client's process of meaning making, you cannot really, the data or the quantitative or any indicator of change in research does not tell you the whole story. So that's, I see both of them connected. It's just that your intention is different.
All right. Yeah.
As a
So
researcher, your intention is different. As a clinician, your intention is different. But I think for me, because I'm primarily a clinician and then a researcher, so I see a lot of, I cannot cease to be a clinician when I'm doing research, and I cannot cease to be a researcher when I'm in a session. So it is something that is integral to my own approach to understanding and discovering a phenomenon. I see a lot of parallels.
interesting. Okay, you have supervised master students and also the PhD students doing qualitative research, and maybe you have also examined several of them. What do you see that now my question have two parts. First, what do you see, what kind of common challenges MS students and PhD students face while doing qualitative research? And second, do you think that master's students doing MS in clinical psychology and the students in PhD, they have same sort of challenges while doing qualitative research?
Uh, hmm, I would say more or less same. Because why I'm saying that? Because what is lacking is the same, perhaps. Uh, because I'm saying that the personal reflexivity is missing. So if a personal reflexivity is missing, whether it's a student from enrolled in MS or PhD, the person would have the same challenges. So personal reflexivity is something uh, that is very integral. If you don't have that, if you are not aware of your own ways, biases, your own realities that impact the subject or the whatever your phenomenon that you're trying to study, this enmeshment is very dangerous. And it gives you a kind of false certainty that you have studied the phenomenon, whereas you have studied your own, like through your own curiosity, try to answer your own question that drove you towards psychology. Most of us are driven to psychology because there are some unanswered questions and you want to find answers. And we think by finding answer, we are going to heal ourselves. So it's mostly a personal journey of healing, which is good because that helps in many discoveries, whether it is Freud or Brewer or anybody. We think we have gained a lot through this personal investment. But when we can't separate me from my research focus or whatever and the study is, there's so much, you can say, subjectivity in the process that you cannot, it is hard. I found this to be most difficult in our student, that they have it at a superficial level, but when they engage in the process, somehow it gets lost because they think that, yes, this is it. And then it becomes harder for them to keep that separation further as they grow into their research phase. Because initially they would know, but as they start talking, because now they're getting a data, they're getting something out of their interview or whatever methodology they're doing. So they think that this is the truth. And then how they're looking at it, this how they looking at it themselves, and they looking at it. So it's me and my glasses. So me and my glasses interfering with the object or the phenomenon that I'm studying. And I'm not aware of it because I'm looking at it, it's unfolding before me. So I think this is the truth, this is fact. This is as truth, as universal, and everybody should agree. So that is the hardest part. And then comes the epistemological reflexivity, because how my method, my theory, my perspective, my looking at it, whatever, whether it's psychodynamic, dynamic, and CBT or whatever, that is in a way defining and framing my view, how I view this phenomenon. So these both, I think, ये वही खेल लड़कों का हुआ, दीद है बीना ना हुआ. So to see the grain, to see the world in a grain of sand. So how do you see the world in a grain of sand? This requires a lot of years spent on developing that eye.
All right. Okay, so I can understand that it is very difficult for the novice researchers, especially in qualitative research, how to position themselves in the research and how to do a kind of participant-centered research. And I think same challenge they have experienced when they are doing case studies, because they have to go for client-centered case studies rather than using, yeah. So I understand that. Okay, but now a more general question about what are the facilities or what are the training we are providing to them? Is it sufficient, and how we should do it? And I am talking it not about your institute or our institute, but I am talking about your general view, the qualitative research in psychology in Pakistan. Is it enough support for students and for supervisors that we are providing them?
No, it is not. And sometimes I wonder what kind of contribution we have as a psychologist from this part of the world. What have we contributed and really highlighted the phenomenon or the experiences that we go through? So when we try to understand and look at our own phenomenon, we borrow the lens that the West has provided and try to apply it either through quantitative methodology or qualitative. So it is not the novice who is really struggling. Even the so-called established researcher, when you try to see their published work, I really feel sad, because this is again, this speaks of the same lack of, you can say, perspective and the spirit of qualitative research. Because we bring the definitive and exactness of the quantitative science into qualitative research method. That is our desire. That's how we feel safe and secure. So we want as many a time numbers, frequencies, something that is crisp and clear, so that I can say, look how these many codes and these many categories have emerged, and something that translates into numbers. And also, those who are going towards qualitative psychology, they are doing more qualitative research method. They're more going fancy mixed method research. Again, mixed method has a, like a, you can say, the safety of like holding you, that, oh, you're not going to fall. You have this quantitative part. So yeah, so you do that qualitative and take that, confirm your understanding by gathering numbers. So that is so. And I think has a lot to do the way our curriculum is designed. There's little room for critical thinking and development of the habit of mind. So therefore, reflection on the content of learning is missing in the curriculum and in the way we teaching methodology. So therefore, it is missing in general. And I don't think you ask for what support and is available for qualitative researcher. So I'm sorry, there are very few who have that lens and who would be flexible enough to really even doubt their own methodology and not sound like an expert. Because whoever knows a little bit of research, qualitative research, now comes across as an expert and tries to tell you that this is the way to do things. So when you say that you really regiment it, that this is the only way to do it, what happens that the student is looking for a surer way of not making mistake.
All right.
Again, falling in that trap.
Yeah, and I think this is very interesting because you know that when you and we have organized that first qualitative research conference in Pakistan, we were wonder that how the qualitative research is being done, and both of us have discussed these kind of weaknesses in
Yeah, that was an eye opener. Yeah, a shock.
Exactly. But what do you think after, for example, after that conference in 2020, and now it is almost the end of 2022, do you think that the institutes in Pakistan, they're offering or they are interested in more qualitative researches in psychology, but with less investment in qualitative research?
Just after we organized that conference, we went into the shock of pandemic. So we spent the 20s and 21 in dealing and recovering from that shock. And the kind of damage it has done to teaching and whatever facilities for research was available, again, I think that were compromised. Even those who think that there should be such guidance and supervision available. The hardest is where to find it. And, I don't want to say much on this subject because then I would recall a lot of difficulties that I find in hiring the right kind of faculty and with who really have the understanding to guide and supervise research. There's this dearth. We have researchers who are engaged in qualitative research. You would find publications in our journals as well. But when it comes to teaching, it is deficient. I don't know. I don't have a simple answer to this because we need to build it and we need resources to build it.
Yeah, now this makes sense because when you are going to teach qualitative research, you have to face very different environment rather than when you are doing it as a researcher.
Yeah.
Okay, so my last question, it is more about your suggestions. What roadmap do you think or you suggest for helping students doing qualitative research in clinical psychology, that roadmap that can help them to do qualitative research in the field of clinical psychology?
Yeah, I think roadmap. There's a lot that I can say. The first thing is that the student has to read first, read and expand their own understanding. Because when you engage in critical reading with reflection, and both personal and epistemological reflection, then you can really understand the work that you are reading. So that is a little missing. The student try to, even when they do literature review and I ask them question, they find it hard to answer my question. So they have to read and also read a specific qualitative research method that they are more interested in, how different researchers have used it in the area of their interest in general. Not only read for the finding, but also the methodology. So read and equip yourself, and you can do it in your own time. That is something very important. And if you haven't done that, then no supervisor can really fast forward your pace. You can't do that. And the next best thing that you can do is that find somebody who has really an interest in qualitative research. So unless an integrated supervisor is invested, not every supervisor can help you in your journey of this research. There are many training opportunities available. One can use that. There are like in many platforms, learning platforms, you would find courses that you can attend, and one must prepare. So there is a phase of preparation, and then you enter into the field of research, and then you do research, and then you sit with your research. So it requires time. What one must do, how much investment they have done in terms of preparation for doing qualitative research. Without the preparation, you cannot enter the research phase. So a lot of investment, time, reading, effort. And then I would say that before you just undertake a research for your degree, do a simple pilot some study, whatever area that you're interested in. See how the process is for you. Get some supervision on the process. Then maybe your probing is not right. Maybe your questions are not framed rightly. Maybe you're not asking the right question at the right time. So audio record, take supervision, get your process right. So before embarking on the real journey, take short, you can say, trips, and get some supervision on those trips that have you done right, and then get the supervision that you choose the right method and understand the philosophy behind that method. Because without the philosophy, you cannot use, because every method is deeply rooted in some philosophical position. And that is something, again, a problem, because people doing qualitative research are not aware of the philosophy behind that research. So therefore, the phenomenon that they're studying is seen through a lens that is not appropriate to view that phenomenon.
Yes, I agree that because I have also seen that there is a problem with the philosophy of using qualitative research method, and that is actually the backbone of those
Yes,
methods. Why we're
yes.
using that? And
Hmm.
yes, few days ago, I mean maybe a month ago, I uploaded a video that was about helping the people who are interested in doing PhD, especially with qualitative research. And the title of my presentation was "Think Before You Leap." So
Yes.
it was similar to see.
That is the preparation phase.
Yes, yes. And
Yeah.
for this phase, you are right that students should go for a pilot study. They will know their strength and their weaknesses while they are doing interaction in the real world, because it is very important that you are not only going to touch the social world of the participant, but also their psychological world when you are talking to them.
Yeah.
So it becomes more sensitive.
Hmm.
So we can talk a lot about clinical psychology and qualitative research clinical psychology, but of course it was an interview that was short, and it was just to give an idea to several students who are interested in doing research in psychology, qualitative research in psychology, or who are already doing their research. So I'm very grateful for your contribution for my channel and for my viewers and the students, and I'm sure they will get a lot of help from the points you have raised here. And I am also, it's my wish that someday in Pakistan we have a qualitative research network in which we can engage several experts and several trainers and students on some organized forum to initiate a more progressive qualitative research in Pakistan.
Yeah, I think we should do something about that. And why don't you take initiative and we do this?
Yes, yeah, I
Someday,
agree with
someday
that.
going to be a reality when we do something today. Otherwise, someday would always remain someday in a distant future.
Oh, yes. Yes, you're right. And you have thrown this ball in my court now.
Yes. Yeah,
uh,
that's my job.
yes. Okay. Thank you very much, Professor Salma Siddiqui. It is very nice talking to you. Uh,
Thank you.
thank you very much.
Wish you all the best in all that you do. And I must thank you that even being away from the department, you're already always available for our student. And really, I owe a great deal. And I trust whenever we have any confusion, I say that just go to Dr. Azhar and he'll answer your question. Thank
Oh,
you
yeah.
for being there.
Yes. Thank you very much. Most welcome.